Well, greetings, students. Today we are visiting with Dr. Kaitlin Costello, and Kaitlin is a colleague of mine, an associate professor at in our MI program at Rutgers, and I'm going to let her introduce herself. Caitlin?
Hi, thanks so much for having me, Joyce. I'm Kaitlin Costello. I'm an associate professor here at Rutgers Sky, and I study personal health information. I'm interested in how people understand their own health information needs and then how they go about finding information to meet those needs.
Great, great. And so the reason we're talking today is because I want my students to understand more about a category of information seeking that has to do with health. And my students, as we've talked about, encounter health information seeking from communities and patrons and patients and students in a variety of different settings, and their need for understanding this particular type of information, finding and sharing, is really important in a few different ways. Maybe we can talk about big picture here.
Absolutely. So, typically in the information science and the library science world, we call this consumer health information seeking. And I have some small issues with the word consumer, right? Because patients aren't necessarily consumers, they're people. But in general, when we think about how people look for health information, we're talking about consumer health information seeking. And people often have a variety of different needs. We know that at least as per the last statistics that I'm aware of, 80% of people have searched for health information online. I think, based on my personal experience, is probably much closer to in the 90s or maybe even the high 90s. How many of us have searched for a symptom we're having or looked up in an acute situation, right? You think maybe sprained your finger, you Google that, right? All the way to something chronic, right? Where you have a chronic condition and you're trying to understand it over time. So people have different kinds of needs when they're looking for health information, but looking for health information online is something that many people do when they have internet access.
So, Caitlin, things have shifted since I was a librarian in the very early days. Now, it's very likely that a person won't come to an information professional until they've done a lot of preliminary exploring. And how do they usually do that?
That's a great question. There's usually two kinds of things that might happen before somebody goes to an information professional or even to a clinician. We know that people prefer to go to clinicians with their health concerns. That's their number one preference. But access to clinical care is difficult, right? We live in a country where accessing care on the go happens in, doc in a box kinds of clinics, right? And often people don't necessarily have a long-term relationship with a primary care provider. And so people really do prefer and often need to do more immediate searching that's more accessible to them. So they'll search online or they'll talk to other people. Getting health information from other people, either friends, family, loved ones, is incredibly common. And that translates when people look for health information online, often, especially in these more chronic situations where someone has a chronic health issue, they're looking for other patients who have similar experiences to them. The other thing I want to mention is that when people look for health information, often we don't exactly know what we're looking for. We might be Googling a symptom, we might be Googling even just an emotion or a feeling that we have about what's going on. But until you really know the vocabulary and until you find, right, other people who know that vocabulary, it can be difficult to get from the point of needing information to the point of actually finding information. And so other patients or other people are a really important conduit that kind of helps people access what they're looking for. So people love getting health information from other human beings.
So that leads us a little bit, I think, into our conversation of the types of information sources there are out there that librarians need to be aware of, information professionals, and the person with the health information need as well. And you mentioned that in the old days, we would talk to friends we knew who either were knowledgeable or had similar conditions. And we can find more of these people now and spread out all over the place. And so one of the buckets that we can talk about. So let's imagine there's the reference bucket. There's kind of library professional database search bucket. There's various different search engines. There's social media. And then there's this category, probably many more than that, but there's also this category of finding people like you online, communities. How prevalent is that?
Well, in the more chronic conditions, I would say it's more prevalent. So when you have a chronic long-term condition, um, especially if it's rare or unexplained. So I have this book that literally just happens to be right next to me, called Divided Bodies. And this is a book about Lyme disease and chronic Lyme, which is a contested illness, right? Some clinicians don't believe chronic Lyme exists. Some believe that it is a very real condition, right? We've seen this also with things like long COVID, right? The CDC has come out and said long COVID is real. It's a real concern. I believe there was just a bill that was put up in Congress asking NIH to put I want to say a huge amount of money. I'm not going to quote the dollar amount because I don't remember it, towards long COVID research, right? But sometimes with these rare or unexplained illnesses, right, something's wrong, but you don't know exactly what it is, and your doctor's kind of stumped, right? That might be a place where you're really trying to find other people who are similar to you. The other thing I'll mention is in studies that I've done with people who are users of these forums, right? They find these forums online where there are clusters of patients who are similar to them. And I'll show you two examples of websites that are patient websites where you can find people like you.
That's such a great title.
Isn't it a great title? It's called I Hate Dialysis. And this is a forum for caregivers and patients who are on dialysis, who may need dialysis. These are people whose kidneys are failing. This is a place where people, right, talk about that experience and their illness. And one of the things that's really interesting about this space is that when I've talked with people who are active in these forums, they say they weren't looking for other patients when they went online. They were looking for health information, and they stumbled upon these communities, these pockets of people that had similar issues. And then they kind of realized that's what they were looking for all along without knowing that's what they were trying to find. This is another example that you may have heard of. It's Patients Like Me. Patients Like Me was developed by two brothers who had a sibling who had ALS, which is also known as Lou Gehrig's disease. And this was maybe 10 or 50, at least 15 or 20 years ago now at this point. I got to do my math better. And, there was very little information available to them. So they created this patient community originally for ALS, and now it's spread out and it's for all different kinds of conditions. So you can log in here and you can find other patients that have similar conditions and talk to them about their drug regimens, understand their drug regimens, right? Another good example of this is mast cell activation syndrome, MCAS. This is an unexplained illness where your body kind of reacts like it's allergic to things, right? Again, finding other patients who are experiencing similar things to you when you have a rare condition like MCAS, or even a common condition like kidney failure, right, can help you even understand what kinds of questions you need to ask your doctor. So people do really appreciate getting information from other sources of people like them. The other thing I want to mention here, right, is if we look at I Hate Dialysis, the word hate is right there. And their slogan used to be, "We're not negative, we just hate dialysis."
But
And
there's an affective nature to some of this too, isn't there? Let
1,000.
me unload.
Yes, yeah, and let me share my feelings about, having to be attached to this machine for 3 days a week, and not being able to travel, and my work is not the same as it was, my relationships are different. I really need emotional support, right, at that point. And, I'm thinking about a participant in a study that I did, explaining her emotional support quilt. And she said,
Mm.
one of the pieces of that quilt is these online forums where I get not just information about what people are doing, but I get to understand how they're feeling, and I don't feel as alone because I'm not the only one going through this. So that's a really important, I think, piece of the puzzle with health, is that we're dealing with people who have a very visceral need, right? It's your body or the body of someone you love, right? You're a caregiver and you're looking for information for someone that you give care to, or for yourself, right? It's very, very personal. And of course, there's going to be big feelings associated with health stuff. So as information professionals, understanding that people are looking maybe not just for information, but also for emotion, also for support, can help us maybe gear people towards sources that can provide those kinds of things, right? Because people aren't just looking necessarily for factual information about their condition. They're also looking for understanding, commiseration, solidarity, right, with other people.
Yeah, this is important because I think that a lot of people don't understand this is a category of the things that I could benefit from. And librarians as information professionals, I think you have to be careful about recommending this particular group, but might you say there are online communities that you might want to explore? You might want to look on Facebook. You want to be careful. How would you approach this as an information professional?
That is a great question and a really good point, right? And so, kind of, I know that you guys have probably talked with and learned a lot from Joyce about, right, like understanding what the needs of your constituents are. But in health information, like with everything, knowing your community and knowing your patrons is really, really important, and knowing what kind of thing they're looking for. And again, we're not giving medical advice. We're not giving, right? We're not saying, here's the best forum for you, right? Because we don't actually know that, right? But being able to say, you might want to search dialysis online community, giving them the term online community to append to some of their searches can help them start to find these places, if that's even what your particular patron is looking
Right.
for.
And in terms of search, I'm thinking also, so this works in a general web search, but if you want to dig deeper into social media, for instance, to find that Facebook group, if you do hashtag dialysis or hashtag something else, you might also discover, or maybe you need to do a different format for finding Reddit groups or Medium blog posts or whatever, but there are if you think about searching to help this person search or to suggest they use these in searches um, as a way to find these communities. Also, I mean, to think about not only hashtags, but at signs, right? So, you might find various different associations or scholars who are looking at these things through a combination of these strategies. And then you might think about, hey, wait a minute, I'm doing a LibGuide for this particular type of community. I'm working in a community college and I'm serving the allied health community there. These are things I might want to say in this category, in this box on my LibGuide. Remember that social media, online communities are a valuable form of information for some people. Here's some suggestions for your search.
Yeah, I think that's a really good point. Right. And also another good place to find lists of social media or of online communities is if the condition that people are looking for has a foundation or a board, right? So like the National Kidney Foundation or the Cerebrospinal Fluid Leak Foundation, right? Finding a foundation or a nonprofit that serves patients and clinicians in that specific topic, they often have this kind of information too. And that's another really good place to find general health information for people. So the other thing people might be searching for, not just that social or emotional socio-affective component, it's also they're looking for health information, right? And so being able to point them to authoritative sources like a foundation. There's a couple other kind of general places that they can go. Things like Medline Plus is a really good spot, especially if you're working in a public library setting, say. Medline Plus is part of the NIH, and it is connected to PubMed, which is a large, very large open access database of all NIH and NSF health related funded projects.
So
So
some of our students might need one, and others of our students might need the other. would you be willing to share a little bit about them online or?
I'd be happy to. Let's take a gander at, let's take a look at, let's start
Because I
with,
think this will lead us to a bunch of other things that we need to know about medical information.
I think that's right. So let's take a gander first. There is a picture of a skeleton on this page, just
I
as an
won't be afraid.
FYI. Okay. So here they have a featured topic this week, but this is Medline Plus, and Medline Plus is related to the National Library of Medicine and the NIH, which funds NLM, right? And Medline Plus here, we're just going to click learn more about it. And if you're really, really interested in this stuff, and in getting really deep into Medline Plus and some of these other resources that I'll share, we do have a class 545 health sciences information where we go into this stuff in a lot of detail. So we spend a whole week or maybe two on Medline Plus rather than a 5-minute drive-by like here.
Can I expand this commercial? I think a lot of people who are coming into our introductory courses, you and I teach 2 introductory courses, may not be aware that this is a profession that may be really exciting to a lot of people. You can develop this as a specialty by taking some of Dr. Costello's courses, and there are other professors in our program, and this may be rising as a concentration. So if you want to prepare yourself for some specialty, this is interesting to you, as it's interesting to many of us, think about learning about this in our course here in 530, but also take some electives or consider the concentration. Sorry for the interruption.
No, I appreciate it. And, I'm going to give another plug really quick for the consumer health information specialization. I did have to Google it. But this is a program that, and I'm working right now with them to partner with us at Rutgers to offer the CHIS specialization without a fee for our students that take these
Wonderful.
more specific classes, which is really a wonderful process that they have. But the CHIS specialization it's like a certificate that you can put on your resume that demonstrates that you have expertise specifically in delivering health information to patients, to consumers of health information.
This is created by NIH.
Yes, NLM, the National Library of Medicine, which is funded by the NIH. These government agencies have a bunch of different offices, right? And they all, but it's actually a pretty lightweight program, the CHIS, and some of our classes count fully for it. So the National Library of Medicine is just a really great resource all around, and they do offer this specialization. You take a couple classes or one class at Rutgers, and then you can put this on your CV. We have several students who have gone through the CHIS program, and I'd be happy to put you in contact with them. They've graduated, but they're always happy to talk to Rutgers students about their journey becoming medical librarians. So to go back to what Joyce was saying, this can be a whole career, medical librarianship, or you can be in many different kinds of settings and deliver health information to patrons. So something like a public librarian, where you're working in a public library, and then you do get patients who have health questions. I know that one of our former students was at Scotch Plains Library, and she set up a program after graduating with her CHIS. She set up a program there at Scotch Plains where people could come in with their health questions for, I think they had like an hour open office hours every week, and they would help people walk through those questions and then identify some useful sources for them to look at. So again, as information professionals, our job is to help people understand how to find good, credible information, right? We're not
as a add-on to that, I just want to say that you might also find yourself in an academic library working with nursing students, medical students, or you might find yourself working in a hospital, giving support to doctors, or working with doctors who are doing research. So there are a lot of different settings. But now back to the consumer part that you were saying.
Yeah, there are so many different settings. And if you're really, really interested in this, the National Library of Medicine also has a fellowship program where you can be embedded in a medical library for, I believe it's a year. We have some former students who have done that NLM fellowship program. And so again, if you Google NLM fellowship, NIH, Medical Library Association, that information will come up. So this
Like
is,
a lot of side trips.
we are taking a lot of side trips. There's so much information here
Right.
and so little time to go through it. Medline Plus, though, let's get back to this.
Mhm.
Medline Plus is really wonderful because it presents health information at a very clear, right, easy read level. And so, right, if I have a health topic that I'm interested in, let's just click here on
So this
diabetes.
is a browse approach.
Yes, this is the browse approach. So what we can see here, right, is all of the stuff that they have related to diabetes here. So let's click on one of these because I want to bring you to, yeah, so they have these beautiful pages, right, where they have, you can test what you've learned on the page, right, some interactive stuff, which we know is great, right? Summary, start here. So let's start here, right? So here's some resources that they're pointing us to learn more. What is diabetes? Also available in Spanish, right? Some very basic information here. So this kind of thing can be really, really useful to point people to when they have basic questions about, right? My doctor told me I have diabetes and I don't even know what that means, right? Which does happen to people all the time, right? This is a great place to point people to get some basic, credible health information. One of the other things I love about Medline Plus is everything is sourced, everything is linked, and trying to find, find an expert. So here's a list of, like I mentioned, the American Diabetes Association, foundations, and then some journal articles, right? So we can actually see, right, these are references and abstract from PubMed. So this is a PubMed open access article, right? Anything in PubMed, I think at this point it's open access immediately. There was an
Great.
embargo for a while, but this is any researcher who gets NIH funding to do their research about health has to make their articles available to the general public, right? The
Right.
taxpayers paid for that research and now it needs to be available to them. So this is an
So,
amazing resource.
Kaitlin, just if you go back a little bit to the top, notice we're speaking in 2024 right now, and this article was published in March 2024. So you talked about the word embargo. Very frequently, even with very open databases that we're using, the last year's worth of information may not be available to be published in a database. It's part of the journal. You need to subscribe to the journal and have it in your hands. And so with medical information, it's really important that the information is available quickly and as close to possible at discovery time or the end of the study. Typically, medical information is taken a very long time to be published and then indexed and then available. And so the idea of no embargo is really, really important here
Yes,
and open
exactly.
access.
Yeah, medical information gets stale very quickly, right? And so the other thing I want to mention too is if an article is not available to you, let's say you're working in a public library setting and you don't have access to that database, and your patron wants access to that article, there's a variety of ways they can get it. One really good thing to do is to just email the author, who's listed as the contact point. It's usually the first author. You can usually email them and just say, I'm interested in this article, and they'll often send the PDF, right? As an
Yeah.
author of articles like this, I'm allowed to share my research with people who are interested in talking about it for research purposes. So that is another good way for people to get access to things. They can also go to their state university library and often get access there.
So I've
So
never been turned down when I've written to an author. But the other thing is use the word repository with that author's name or the title's name in your search, or go to the university archive where they've been. There's a repository or an archive at most universities where that material may also be housed with ethically housed. So yeah. So don't imagine that you cannot get to an article that you need or your patron needs.
yes, exactly, 100%. So, we can see here, right? We can even see what kinds of methods they used to do the study. And if you're helping people find credible health information, understanding that randomized control trials and then systematic reviews or meta-analyses are the gold standard of evidence because they've either done a really, really big study that was randomly sampled, or They have pulled a bunch of different studies that have already been published together and understood their results together. That's kind of the gold standard, the best medical evidence that we.
So in your field search, when you select a methodology, you can select those particular methodologies that Kaitlin suggested and get to these systematic reviews more easily.
Yes, 100%. And it says right here, this is a controlled clinical trial. We might want this to say systematic review. So one thing that we could do, right, is we could type in, let's type in type 2 diabetes here. And you saw that was just a free text search, right? Nothing fancy. But if I go over to the side here where I have my facets, right,
Mhm.
I can say I only want systematic reviews,
Yeah,
right?
love
And I
that.
can even say, right, I only want them to be from the last 2 years, from 2023 and 2024,
That's what I
right? And
call fancy field searching.
exactly, exactly. Another really good resource to know about if you're doing this kind of searching in something like PubMed is, you saw I just did a free text search here, but let's actually grab that string. I'm going to show you the mesh browser really quickly. So the mesh browser is a database that teaches us about the subject headings that are used in medical literature. So this is our controlled vocabulary. This is our taxonomy for medical literature.
So
And one of the
your access to this has been just on the free web right now. You haven't
yes,
logged into anything.
I'm not logged in anywhere. I typed in mesh browser in Google and clicked on the result because I couldn't remember the URL. And as you can see, it's a .gov here. It's nlm.nah.gov. It's just our mesh browser. And so I can actually put in type 2 diabetes. And rather than looking for an exact match, I'm going to just look for fragments here because this is going to show me, right? Here we go. Type 2 diabetes matches to the larger term diabetes mellitus type 2. So if I click on this, it's going to take a second, but this is going to show me, right? This is the subject heading. So if I really want to find articles in PubMed that are about diabetes, it's better for me to use their exact controlled vocabulary, maybe even in an advanced search, right? Where I'm putting it in as a mesh term.
Mhm.
And we can see here all these different entry terms. So what this means, these entry terms are, if somebody puts this in, it's going to map. So
Mhm.
if I write in diabetes mellitus slow onset, it's going to map right to this type 2 diabetes mellitus term. And we can also see here, one of the things I love about this is the tree structure, because this teaches us, right, where the term is located in the larger taxonomy. And we can see here, it's nested underneath glucose metabolism disorders and also underneath endocrine system diseases. Right, so we can see there are two places that it lives in the taxonomy. And one of the things that's useful about that is we can see what's nearby, right? And so we can say, okay, these are things that are related but aren't exactly the same. So if my patron's really interested in complications, well, now I've found a new term, right? Just by looking at that browser and by kind of understanding the structure of the taxonomy that's used when we talk.
It levels the playing field to some degree, right? Because most of us don't go into a discipline or a concept area that we're unfamiliar with the vocabulary. We really need to do our exploration.
100%. A lot of times, right, we don't know what we don't know, right? So we
Right.
don't know what to look for if we don't know. All we know is that we have this, what I like to call a perceived wrongness, right? Information seeking is often about, there's this, I know that I don't have the information I need. I know that something's weird, right? And I'm going to search, and maybe that will help me pull that perceived wrongness right together and fill that gap, right? That
Yeah.
that I'm experiencing.
Right, right.
The vocabulary is one really clear way, right? Not just for us as information professionals, but for our patrons to understand how to find more information, right? As to what terms could I also be using? And this is another really great place. Joyce and I were chatting about this a bit earlier, where generative AI might be really useful, right? You can look up a term and ask it for synonyms, right? Or ask it for other words that people use, right? And that can really help expand your search space just by knowing some new terms that you might not know and your patron might not know.
Absolutely. Yep. Wow. So we like the Zori.
We do. I mean, as information professionals, having uh, a document, right, or a really
Right.
big document is the size of several books, right, that teaches us how information is actually structured can be useful. This is also right. The downside to a taxonomy is that something like, right, I'll go back to divided bodies, a rare or unexplained or contested condition, we might not have any search terms or very few search terms, right, at all. Right. And so again, finding other people who are experiencing that can be a very helpful way to learn and get a bigger vocabulary.
That's also a very good example of the importance of combining controlled vocabulary with free text search. Some of these things are emerging. Long COVID might not, it probably is there now, but it may not have been there, or some other way to describe it in a more complicated, oh, we're going to check it.
I want to know now because I know COVID-19 is in here, but let's type in long COVID and just see if we get anything. Oh,
I
look at
get,
that. It is
okay, but it's called,
post-acute COVID-19
right.
syndrome.
So, but what Medline Plus, or what the Mesh browser did was it translated our layman's language to the language of the database. And we might in another date, if we were using a different database, say we're using PsycInfo, we might want long COVID might have been the term it used because it might not have the mesh vocabulary behind it. But being agile like this is important. Knowing where you're searching and the terms you're using might be very specific to where you're searching. So
Exactly.
this is
Yeah.
exciting.
It's really exciting.
I
I love being able to find these new terms. And then, the other thing that's really cool about this, right, is this this won't.
know it's the history of the term.
Yeah, but yeah, we can see the history of the term. So you can actually see, like, with something like this, there's not a long enough history, but words change over time, right? And there are some examples, right, in the mesh catalog specifically, right, of terms that were very offensive that we have replaced, and we are using non-offensive terms, right, in 2024, right? But if we look, we're going to have a note that explains exactly how we got from there to here, which is really important, right? We can't erase that part of this taxonomy, right? Just because it is
Mhm.
problematic, right? We do need to keep that record alongside just for us to see, right, how we've understand things as research has been done, as time has gone on, as we understand whatever the medical condition is that's being cataloged more and more.
And that's really interesting. I never noticed that. Thank you.
Yeah, it's cool. I love the mesh browser. I'm
I
a
can
big
tell.
fan of it. Yeah, you can actually also access it through PubMed directly. Like if I
Yeah.
type in long COVID here, I am pretty sure that it will do the map for me. Oh, I have my filters on here. Oh, I think you have to do something special to make it map for you. But you can ask PubMed to map your free text search terms to mesh for you behind the scenes so that you're getting stuff, everything that has, right, this particular um uh I don't want to use the word tag, right? But has this particular subject heading on it,
Yeah.
right?
Metadata.
Yes, that in its metadata that may not have the term long COVID in its metadata.
Right. So you can actually search something like you can do all fields, or you figure out the right field to search long COVID in. Um, I would consider it in a title or in an abstract, some to if I wasn't sure if it was part of the subject headings or the established vocabulary. Anyway, what else should we be talking about? We talked about some social media. We talked about communities. Are there other databases that are important for our students to know about?
The other one that I'll quickly mention is Up to Date, which is
I love that one.
Up to Date is a wonderful database, but I think we're going to have to log into the Rutgers.
Yeah. While you're doing
Security.
that, I had one of my nephews was engaged to a woman who was at Temple University as an ER doctor. And she, I asked her how she deals with all the people who are coming into the ER and how does she make these quick decisions? And she said, I have a secret weapon. And I said, is it up to date? And she said, what? But yeah, these things are available in the Rutgers databases and are heavily used in practice. And there are some doctors who may have been trained earlier who may not even be aware that something like this or clinical key or some of the other things exist. And some of the materials there are good for, let's call them consumers as well as medical researchers and professionals.
Yeah, 100%. So when people go to the doctor, they'll often say, and then I saw he just the ER doctor just Googled this. They probably didn't Google it. They probably went to Up to Date.
Mhm.
Up to Date is a it's a database available mostly for clinicians, but we can also get to it here too. We're going to do the browse situation. I pulled up anaphylaxis. So you've got a patient that, their throat's closing up acutely, right? And you want to know what to do here. So we can see on the side here the diagnostic criteria, right? So this is a database really geared towards clinicians. So if you're working in a clinical setting alongside, right, like a doctor or nurses or care providers, right, this kind of information is very different than what we might get from something like Medline Plus. So I actually want to compare and contrast Medline Plus to this really quickly. So Medline Plus is for, right, just a general population. So if we look up anaphylaxis here, right, we're going to get a similar kind of page, right, where we have a summary, what it affects, what's happening here, right? And we can see even just from the first sentence, right, we're using a lot of medical terms here, right? Systemic hypersensitivity reaction caused by the sudden release of mast cell mediators. Okay, what do we call it here, right? It's a serious allergic reaction, right? We're saying the same thing to different audiences with different language, right? And expecting a different level of knowledge coming in, right? And expecting a different use for the information. So somebody looking up anaphylaxis here probably isn't going to be treating patients, right? They're probably experiencing it themselves or they know someone who is. Whereas here, we really want to know not just how to diagnose it, right? But how to treat it, right? And then we do have this lovely, right,
Yeah.
information for patients tab that is on almost every single up-to-date page, right? That points us towards resources that are for lay people, for patients
And
rather than
as I remember, some of these are PDFs that could be distributed. Is that right?
Mhm. Yes, I believe that's the case. So let's see here, like, yeah. So again, right, what is anaphylaxis? This is a serious allergic reaction, right? Kind of similar to what
Yeah.
we're seeing in Medline Plus here. What are the symptoms? Should I see a doctor?
Mhm.
Right? These kinds of questions that people might have, right, immediately.
And there's
The
the
other
patient
thing,
education stuff, which I think is really helpful.
yes, and the other thing that's lovely about Up to Date is that, right, we can see
Mm.
here it gives us all the information about who wrote these pages, about who our authors are. And then I'm not sure about the patient education material, so I'll go back to this. But here we're going to have, right, all these citations. This is all the medical information that they're the
Yeah.
scientific literature that they're pulling from in order to make the claims that they're making on this page. And then I think right at the top here, yep, we should have, right, literature review current through July 2024. So that's really current, right? It was last updated in May, right? So, and we can see who the actual authors of this are and even look at their disclosures. So when we're trying to understand the credibility of an information source, knowing how literally up to date it is, right? And knowing
Yeah.
who's writing this stuff and whether or not they have any ties to the industries that, the pharmaceutical industries is one example, right? It's really important for us as information professionals. So you can vet the information you find on Up to Date and on PubMed very easily. They make that very easy for us as end users. So this would be another database that if you've got access to it, can be really, really helpful for that more clinically focused kind of stuff.
Right. So as a public librarian, I might have access to some of the health info databases and perhaps there's the EBSCO, I think it's still called Consumer Health.
Mhm.
But I also can tell patrons that their university library may be more available to them than they know.
A
Uh,
hundred percent.
yeah. So they can search for the university library that's public or open to them using Google. That's one of the things I've done. And they can just walk in.
Yes, I mean, if you live in a state, right, that state, and you pay taxes to the state, right, the public university is a state institution. Rutgers, the State University of New Jersey, right, we serve the public. We serve the public of New Jersey, not just our students, right? So, as information professionals, I think one of the kind of core ethos that at least I have, and I think many, many of us have, is getting information to people, right? And if you have access to a state university, that state serves the constituents of the state. It serves the public, not just the students.
Right. This is an information equity issue. There are people who, because of the paywalls, we studied that in this class, don't have access to the same information that we do as students and professors at Rutgers. And this is not a fair situation, because the people for whom this is a life and death situation, who care for people who are suffering, this is not right. And so we can give advice to people for whom information is critically important. And so, yeah, so it's something we need to address. Kaitlin, as we move towards the end of this, because we could talk forever, this is a fascinating and a really important topic. What would you like the students coming out of this course to know as they enter the profession relating to ethics, information, and health services? Just what kind of approach should they take?
That's a really good question. I would say the most important thing is that we aren't doctors, we aren't medical providers, we aren't clinicians, we are information professionals, we're librarians. We help people locate and use and information, right? We help them understand their own information needs through a reference interview or through chatting with them. We help them locate information that's credible and relevant to them. And then ideally, right, it's just like teaching, right? You you get you open up the doors and the students fly out into the world and they know how to look for things after they've interacted with you and after they've learned a little bit from you about how to find things. So we're teaching people how to look for information. We are not giving them medical advice. So you never say, oh, you really, the only medical advice you can give is you need to talk to a doctor about this, right? Find an expert. I'm an expert at finding information, but I'm not an expert in health, right? I'm an expert at locating good information about health. So making that distinction, even if you're not doing health, no matter what we're doing, our job is to help people find information and then to have those skills on their own, right? Ideally.
Yeah, and it's very exciting when you can help, when somebody leaves saying, "Okay, I have an idea of how to approach this. Thank you." Because sometimes sometimes people are coming into you in serious emotional turmoil, and that is something that we see very often, especially in public libraries. One more thing I wanted to mention, there are caveats about like ethics and what the limits to our professional training allows us to do, but our training also teaches us to value privacy and protect data. And so right now, I know a lot of people, including myself, are looking for information using AI tools, and those tools are training on the data that we input. And so I think we need to be concerned about that. And I know some of your research might touch on that. So can we briefly kind of mention that from your expertise?
Yeah, definitely. I mean, one of the things that I've always been curious about is that when we look for information, we share, right? You can't look for information without sharing with somebody what you're looking for, right? It's very, very, very difficult, right, to go on Google. And once you've typed it in, Google now knows that I looked for that string, right? And there's all kinds of studies of the predictive analytics that a company like Google or Microsoft, or, these other companies that have these big AI products like ChatGPT, right? The kinds of inferences and predictions they can make. There was a study that came out, I want to say in like 2008, 2009, showing that people's Google searches were predictive for whether or not they had pancreatic cancer. Right. And so, then is Microsoft or is Google obligated to send that person an email and say, hey, you should really talk to your doctor because you might have pancreatic cancer, right? The answer is, I don't know about you. I'd feel really violated if I got an email from my search company that said that, right? And I think most people would agree, even if it was helpful. And so, just being really mindful, especially with these AI engines, looking at the terms of service and seeing whether or not they are scraping your data when they are generating new information later on, because some of them do scrape your data and some of them don't. That's really important. And then, you have doctor-patient confidentiality as a person when you go talk to your doctor. You don't have that when you talk to an information professional, right? So thinking about ways, right? I know I mentioned the office hours for health questions at a public library in New Jersey. If you're developing a program like that, right, thinking about even just simple things like having that happen in a room in the library, in a study room or something, rather than out in the open where people are voicing their health concerns in a public space that's pretty quiet and the only one that's talking is them, right? So, even just simple things like that can be really, really useful in terms of protecting privacy. But what we put on the internet does get chewed up and spit out by the internet. So just keeping that in mind.
Thank you, Kaitlin. I hope that some of you will continue to meet with Dr. Costello through her courses, and consider this specialization or concentration as it develops. And I am so grateful for your wisdom.
Well, I am so glad that we had this opportunity to chat and to catch up. And, I just, before we hit record, Joyce was sharing some really lovely pedagogical tips with me. And I just really admire your pedagogy. So your students are so lucky to have you in this class. And I'm lucky to be a drive-by visitor. And I hope that you come visit me either in my classes or I'm always available on email.